You've probably wondered about this. It's one of the biggest, most confusing questions out there. How can the wealthiest country in the world have one of the most expensive and complicated healthcare systems on the planet? Well, we're going to follow the money and connect the dots to see how it all adds up.
So, let me ask you this. What if an ambulance ride could actually cost you more than a flight across the ocean? It sounds absurd, right? But in America, this isn't some crazy hypothetical. It's a reality. And it's really a symptom of a much, much bigger problem.
And that's where this gets really devastating.
For millions of people, financial ruin doesn't come from a bad investment or a failed business. Nope. It comes from getting a diagnosis, having an accident, or dealing with a chronic illness. So you have to ask, how on earth did we get here? Now just look at this chart. The difference is, it's just staggering. We're not talking about a small gap here. The United States spends nearly double per person on healthcare compared to the average of other wealthy nations. This one image really captures the core problem we're trying to unpack. Okay, so with that in mind, let's start digging into this absolutely shocking price tag. We can see the spending is just off the charts, but what does all that money actually buy? And here's the great paradox of it all. You'd think that the country spending the most would, have everyone covered. But that's just not the case. Millions of people in the US have no health insurance whatsoever. So that begs the question, if all that money isn't buying universal coverage, where is it going?
To answer that, we really have to start by following the money. And that leads us right into the incredibly complex world of American health insurance. This is a huge piece of the puzzle.
So, right off the bat, here's the fundamental difference. Most other developed countries have some kind of universal government-funded system. But the US, it's built around a marketplace of private insurance companies, and that one design choice has massive consequences for the cost.
So for you, the patient, it's never just one simple payment. First, you're paying a monthly premium just for the privilege of having insurance. Then, when you actually need to use it, you have to pay a deductible. That's all out of pocket before your insurance even kicks in. After that, you're probably still paying co-payments for every single visit. And as if that's not enough, you can get slammed with these out-of-network surprise bills. It's a total maze of costs.
And all this complexity creates what you might call the middleman effect. Think about it. Hospitals need massive billing departments just to chase down payments. Insurance companies need armies of people to review and often deny those claims. Sometimes lawyers even get involved. All these layers, they add enormous administrative costs that have almost nothing to do with actually caring for patients, but you better believe they all get baked into the final bill. Okay, so the insurance system adds a huge layer of cost. But what about the price of the actual medicine? Well, that brings us to our next major factor, prescription drugs. I mean, just look at the difference here. In most other countries, the government basically acts like a giant bulk buyer, and they negotiate with drug companies to get lower prices for everyone. In the US, that's not really a thing. Pharmaceutical companies have a huge amount of freedom to set their own prices, and since these drugs are often life or death, patients and insurers don't have much choice but to pay up. All right, so we've covered insurance and we've covered drugs, but what about the places where you actually get the care? Let's talk about hospitals. Here's something you have to wrap your head around: the business model. A lot of US hospitals, even the nonprofits, operate like for-profit businesses. The prices for procedures aren't really based on the actual cost of the service. Instead, they're often set based on the absolute maximum amount they think they can squeeze out of private insurance companies. And that pricing strategy, well, it leads to numbers like this. A procedure in the US can cost 5, even 10 times more than the exact same one in another developed country. It's this lack of any centralized price control that allows for these incredible markups. Now, look, to be completely fair, there is another side to this story. People who support the US system argue that these high prices are actually fueling something really important. And you know what? It's a valid point. The US is, without a doubt, a world leader in medical innovation. It's home to some of the planet's top hospitals and research labs, and it pumps out a huge number of new drugs and medical technologies. The argument is that this high-profit system is what provides the money and the motivation for all this cutting-edge progress. But that brings us to the central dilemma of this entire debate, doesn't it? It's a really tough question with no easy answer. What's the right balance? Is it worth having the best innovation in the world if a huge chunk of your population can't even afford to access it? And this isn't just some abstract debate, These high costs have very real, very serious consequences, not just for people's lives, but for the entire economy.
Like we said at the beginning, medical debt is a huge reason people go bankrupt. But there's another, quieter problem. The fear of getting a giant bill actually causes people to avoid going to the doctor for small things. But then those small things can turn into major chronic health problems that are way harder and way more expensive to treat down the road. It's a vicious cycle.
So at the end of the day, it's not any one single thing. It's a perfect storm of factors all working together. A system dominated by private insurers, the ridiculous administrative complexity that comes with that, sky-high prescription drug prices, and a basic lack of any real control over what hospitals can charge. It's the whole design of the system itself. Ultimately, after you look at all the numbers and all the reasons, it really just boils down to this one fundamental question. It's not about whether healthcare is expensive. The real question we have to ask ourselves is, should staying alive be a luxury?